It's one of Vancouver's oldest neighborhoods where tragically some of the newest innovations in BC's response to the overdose epidemic are born.
You're using it in the alley or they're using it in a back alley.
Drug policy advisor Karen Ward says she sees firsthand the need for more adaptation to the trend seen over the last 6 years towards smoking.
They're vaping off foil. They're vaporizing the substance and inhaling the smoke.
And the downtown east side is at the epicenter of the epidemic.
We should be obviously mandating safer smoking rooms in public buildings.
While there are multiple supervised injection sites, there's only one safe inhalation site in this area. And some, like this Indigenous outreach worker, say that's not enough.
I've actually seen people smoking just outside the safe injection sites, doing their best to be safe as possible. When they're injecting, the infections will come. I think that's where the trend started, where they started smoking.
The latest figures from the BC Coroners Service show smoking is the most used mode of consumption, leading to toxic drug deaths across BC. In some regions, these inhaled doses cause a vast majority of the fatalities, such as 74% of overdose deaths in the province's northern interior last year.
They've been slower to open inhalation sites because in those cold climates, they have the necessity to have ventilation, safety for workers is compounded by the climate.
BC's Minister of Mental Health and Addiction says they're constantly looking for new approaches, especially as the country's first jurisdiction to decriminalize drug use and permitting the prescription of safe supply.
This hasn't been done before, and so we're learning as we go. We're funding every health authority to stand inhalation supervised consumption sites up. And honestly, we just have got our heads down every day on designing new ways to tackle this crisis.
All right. Love you. Be safe.
James Harry Sr. says for his people who were disproportionately affected by the crisis, a culturally appropriate response is critical.
Knowing that they got a little taste of home, just a little taste, right? And that goes a long way.
As many of those on the front lines continue to be relied upon to inform the next steps in the evolving response. Neetu Garcha, Global News, Vancouver.